For more on the listeriosis outbreak, I'm joined in studio by Dr. Juno Thomas from the National Institute for Communicable Diseases. Good evening. Thanks for your time tonight.
Good evening.
Firstly, one of the things that we're seeing is that even post the recall of those enterprise products, we're still having new cases of listeriosis reported. Why?
So firstly, the incubation period of listeriosis is very long, and this is from the time where you eat the contaminated product to the time where you actually fall ill, and it can be as long as 70 days. So some people who ate a contaminated product just before recall might not even have developed illness yet and might still only present in the next few weeks. In addition, I mean, although the recall was announced on the 4th of March, it's possible that some people still had the product in their fridge for a while thereafter. So, we can expect that we are still going to see some outbreak-related cases in the next few weeks, but the number of new cases week on week has decreased dramatically since the recall.
One of the things I'm also seeing is that you interview those who have, developed listeriosis. What are you trying to source from those interviews?
So we've been interviewing patients since October, November last year already to try and see if there's any patterns of food consumption, that might alert us to certain food types that might be associated with the outbreak. But even now that we've identified what caused the outbreak and the kind of food associated with it, we continue to do interviews just to make sure that we can understand, how many people did report directly eating it, or did they have it in the fridge and did it cross-contaminate other products in the fridge. Also, although we know that this outbreak strain has been responsible for over 92% of all our cases, it still means that there are 8% of patients who are getting ill with listeria of other strains that might come from different kinds of foods. So we're making sure that we're gathering all that information and can use it to perhaps indicate if there are problems with other foods that are causing sort of smaller clusters of illness.
All right, well, it makes perfect sense. Today we had the announcement of officials from the World Health Organization stepping in to increase technical support, as they put it. Where were the gaps in terms of how we were responding to this problem?
So World Health Organization technical experts have joined the government, and we've been in meetings to discuss various aspects of strengthening the sort of the post-outbreak phase of surveillance, so looking for patients who fall ill and trying to tie up loose gaps within legislation and food safety issues, as well as coming up with plans going forward to monitor for these kinds of disease outbreaks, and also to give guidance to the food industry as to what particular measures have to be put into place specifically for listeria going forward in terms of controls and monitoring and reporting.
Have they been concerned that we had not been doing that to the extent that we needed to be?
I think it's not necessarily that they were concerned that we weren't doing it to the same extent. The World Health Organization has been on board ever since the minister announced the outbreak formally on the 5th of December. They've been part of the regular meetings, and they've been providing technical input and advice. It was that the government actually requested the World Health Organization to provide additional technical assistance to, in this post-outbreak phase, to make sure that we address all the gaps and challenges that were uncovered during the outbreak investigation.
All right, well, thank you for coming into studio and putting us into the picture in terms of where we are when it comes to the story. It's still one that's far from over, especially as we wait to see that class action that is going to be heading to court. Of course, that would be against Tiger Brands. That was